Thank you, ma'am. And at the onset, I would like to thank the AIOS for giving us the opportunity, especially to Dr. Kashyap, who made me a part of this instruction course. Sir has just briefed us about the ERG and when and why to do ERG. My responsibility is letting you understand a little about the machines and the electrodes. So to record an ERG, we must have an understanding of its basic technology and the clinical protocol associated with it. The basic technology involves electrodes, stimulation of the eye by the light, and the electronic recording devices. The clinical protocol involves how to prepare the patient, understanding the ICF standard ERG, and the analysis and the reporting of the ERG. First, the electrodes. Now, for recording, we have three different types of electrode. Those are active electrode, reference electrode, and the ground electrodes. The stability of the electrodes is maintained by a good connection as it decreases the impedance. Remember, if more the impedance would mean more noise, and that would lead to a wrong reading. Now, electrodes are kept clean to avoid infection and also for its reusability. Cleanliness also decreases the impedance. For good recording by an active electrode, one must use a non-irritating, non-allergic, ionic, conductive, and a relatively non-viscous solution on the skin. Ensure good ocular contact to ensure proper electronic impedance. And although ICF standards are there, we should always define both normal values and a variability for our own laboratory. Now, recording by active electrodes can be done by conductive fibers, foils, conjunctival loop electrodes. Then we have got contact lens electrodes, which are centrally transparent with an optical opening, and it just works like a lead's speculum. It gives the best recording, and even the recording is stable with the highest amplitude. Now, different types of active electrode include the skin electrode, which are mainly used in children. The corneal ERG electrode, they can be either monopolar or bipolar. The monopolar electrodes are the jet contact electrodes. The bipolar are the Burian electrodes. The detail electrodes are most commonly used electrodes now, and then we have got the gold foil electrodes also. The reference electrodes are usually incorporated into the contact lens speculum assembly when you are using a bipolar electrode like the Burian electrode for stable configuration electrically. Electrodes can be, the reference electrode can be placed near the orbital rim or the earlobe or the forehead. Then the third variety is the ground electrode, whereas which is actually kept at a separate skin electrode is attached to an indifferent point and connected to the ground. Typical location for using this ground electrode are on the forehead or ear. Now, what is the actual electrical impulse that is recorded? It is actually the difference of recording between the active electrode and the reference electrode. The active electrode captures the action potential changes and the impedance, which is denoted by letter A. The reference electrode captures impedance only, that is which is denoted by the letter R. Now, the difference between A minus R actually gives us the actual electrical impulse. Now, coming to the specific types of electrode, first is the jet electrodes. These are disposable monopolar contact lens electrodes. The gold foil electrodes on polymethacrate with lead wire. There is an ease of insertion. The movement of lens during recording and absence of lead speculum contribute to the variability of the recording. There is a reduced possibility of eye infection, but the disadvantage is it has got gold plating which itches off with time. Then we have got the Burian Allen electrodes. These are reusable contact lens electrode with a built-in speculum and the lead wire. They are customizable to various sizes. It is ideal for testing infants. The reference electrodes are built into the electrodes and they are in form of a conductive coating of silver granules. The PMA shows variable degree of blurring, so they are not suitable when we are recording ERG where the image clarity is vital. It is usually used for full-field ERG, but remember these electrodes are very costly. The DTL plus microconductive thread electrodes are those electrodes that are used most commonly. They are conductive thread, 50 microns, float on the corneal film surface. It has a negligible mass, low cost, and are disposable. They're convenient to use and they give very clear images. There is no interference with the pupil or the optics. They give a very reliable ERG recording and they are well tolerated by children. Then we have got the gold foil electrodes. They are useful when you cannot use a contact lens electrode or when you don't want to anesthetize the cornea. The ERG amplitude will be substantially affected by this electrode. It requires an adapter. The reference in the ground electrode, a couple of points about it, especially about the color coding. The active electrodes, the wires are usually red in color. The reference is referred with blue and the ground is referred with black. The skin part is usually cleaned for the reference and the ground electrode by skin gel such as a new prep skin prep gel. The cup of the electrodes are filled with gel and are attached for a better conductivity. We use 10-20 conductive type of gel for this particular purpose. Then we have got adapters, which are one channel or two channel adapters. The one side of channel 1 has an active reference and a ground electrode attachment. The second channel, other side, also has got an active and reference electrode attachment. When we have to test for one eye, we usually use one channel, and when we have to test for two eyes, we use the two channel. Now, coming to machine at a glance, the machine as such has got three parts. One is the monitor, the second is the CRT, and the third is the Ganzfeld board. The computer monitor tells us at what stage the investigations we are in. It guides us through the test. And there are two types of stimulation that are present, the pattern stimulation and the flash stimulations. That is taken care by the CRT and the Ganzfeld board. Now, this is a side view to show the electrodes placement. Now, electrodes with one eye is closed for a multifocal ERG patient. Now, there is a movable chin rest that has to be placed in front of the monitor. The patient has to be very adjusted to it. Then the chin rest with the monitor is fixed and the fixation point is noted and the test has started. Monitor displays the random pattern of a multifocal ERG. Then the chin rest is removed and the Ganzfeld ball is now in action. This is a closer view for baby flash, which is used for babies and unconscious patients. Now this is one again picture that shows a Ganzfeld ball, a closer view. The movable chin rest is attached to other place when the test is not being done. Now this is a schematic diagram that shows different electrodes put in different part when we are using different tests. For recording the ERG, the test procedure should be explained to the patient completely. For those tests that require pupil dilatation, the size of the pupil is recorded, the pupils are fully dilated, the patient is dark adapted in a dark room with an eye patch, the electrodes are attached with a dim red light in the room, and then we start the test. We attach the electrode and follow the guidance coming on the computer screen. Safety information for both for machines and for the patients involved. First, for the machine, the printer and an external USB hard drive should be connected via Wi-Fi, and if disconnected, should never be tried to connect while doing the test. The automatic window updates should be deactivated. The dark room should be properly dark. Disconnect the power supply before any cleaning or repair. Should not be connected to, via an extension cord. Always use an external drive to have a regular backup. A password does help to protect the patient's data. Safety information for the patients. The electrode should not be attached to the damaged skin. The patient should be explained about the procedure and the waste should be disposed in household waste. Thank you very much.